Hi there, my name is Vic Veer. I'm an ENT consultant working for the NHS in central London, and this is a quick video about broken noses. Now, if you have broken your nose for whatever reason, and you see that your nose is off to one side, either because of a rugby match or you've fallen over and hit your nose on the floor, whatever reason, if your nose is off to one side, firstly, stop the bleeding because there's often an awful lot of bleeding from your nose. And there is a video about how to stop nosebleeds. I think there are 10 different things you should do about stopping nosebleeds. I'm not going to talk about that today. What I'm really talking about is your nose being off to one side and really what you should be doing to get it back in the midline again. Now, what tends to happen is that the bones of your nose here, if you look at it almost like a triangle, the nose gets pushed over like this and fractured in that way. And you'll get bruising around the eyes and around this area here. You feel very blocked up because of all the swelling inside your nose. Now, we need to get those bones back in aligned again so your nose looks normal and you can breathe better as well, because if it's like this, one side seems more blocked than the other, typically, even after the inflammation has come down. Now, sometimes you can do this straight away before it all swells up. But the trouble is, by the time you get to hospital or see a doctor, normally the nose is so swollen up, you can't really see where the bones are, or you can't really pinpoint how much to put the bones back in the center again. So it's very hard to fix a fractured nose within the first few days. It's almost impossible because the swelling is so great, you can't really see what you're doing. So really you need to wait until the swelling has come down so the ENT doctor or whatever doctor you end up seeing can actually see where the bones are and straighten them up for you. So this realignment or sort of manipulation of the nasal bones to put them back in the center needs to occur before roughly about 2 weeks after the injury. The reason for that, because if your nose is like this, it may heal and set in that position. So you do need to contact someone as soon as possible and make sure that you're seen by the ENT surgeon pretty quickly afterwards. I would not wait to see him at 2 weeks' time, because if you've done that, he'll go, or she will go, well, actually, we need to get you into theatre. That may take 5 or 6 days. So you've already gone past the 2 week mark at that point. So you've missed the chance to push the bones back again. And therefore you're sort of stuck with a nose like this until you get a rhinoplasty. Rhinoplasty is an operation where it's basically a nose job where you break the bones and center them up again. And that can only occur, roughly about 9 months later. So it's an awful lot of time looking like your nose is pointing the wrong direction. So you really need to get the timing just right. You need to wait for the swelling to come down, see your surgeon pretty soon afterwards, typically 5 days after the injury. At that point, the swelling has come down. You've seen them 5 days later. You've got about a week and a bit to get the emergency operation done where you can straighten up the bones again. And ideally, you would have this operation done in theatre. So when you're asleep in a general anaesthetic, because again, as I said before, your nose gets pushed across like this, because say you've been punched this way, your nasal bones have been pushed like this. So you get that sort of shape rather than sort of like a teepee shape. Because it's like this, if you try to do this in clinic where you can do it while under local anaesthetic, you can inject anaesthetic all around here, make it all numb, and then just push with your thumb back again, back into place like this. It doesn't actually come back very well. It doesn't, if you imagine, if you're pushing this way, and you push this way, you just sort of crush it a bit like this, and it looks better, but it's not particularly good. What you really need to do is disimpact this bone. So you're actually opening up the nose and then putting it together right in the right place. So there is an instrument we use in the anaesthetic theatre where we put this sort of forceps up your nose like this, and we sort of disimpact the bone from there, disimpact this bone, and then put them together carefully just in the right space. So Walsham's forceps. Now, you can't do that whilst you're awake. When you're awake with a bit of local anaesthetic, all you can do is push it with a dirty thumb and hope that it straightens up enough. So that's why if you look at the research, using a local anaesthetic and just pushing it back leads to about a 19% chance of you needing a rhinoplasty, a nose job later on. Whereas if you do it in theatre with a Walsham's forceps and do it properly, opening it up and get it just right and put it together again within the 2 week sort of period, there is a approximately a 4% chance. So it's a big difference. Rather than 19% chance, a 4% chance that you will need a nose job or a rhinoplasty 9 months to a year later. So I think the main thing I need you to think about is that if you get a nose fracture, you need to see your ENT doctor relatively quickly, and that means going to A&E, getting booked in within about 5 days afterwards. A lot of people get that wrong. People think that you need to be seen within 2 weeks. That's not true. You need to be seen within about 5 days to give you enough time to get into theatre to have your operation. Now, some people watching this may have missed the boat and thought, oh my God, it's almost 2 weeks up already. So you might have to go to your ENT surgeon and say, look, it's about 2 weeks now. Can we do the operation today? And most of them will say, I'm sorry, it's just not enough notice, so you've got to get you in. So you may end up having to have the correction with local anaesthetic, which is not very nice, having the needle marks around here and a thumb pushing it back. But it's better than 100% chance of needing a rhinoplasty because your nose is off to one side. Now, the other thing I wanted to tell you is that the way to tell if your nose is off center is to get a piece of paper and sort of doing this. And you can see the shape of your nose like this and compare it to the other side as well. And that's one way, once the swelling has come down, to sort of check if your nose is off center, because sometimes it's quite subtle. And sometimes the fracture is not the whole thing going across, it's just one side is caved in, but it's still straight on this side. So there's lots of different types of fractures. And I'm just complicating matters now. I'm getting geeky now. So there's lots of different types of fractures that sort of one side caving in rather than the whole thing moving across. But let your surgeon work that out. Sometimes you just have to go in on one side and flick up the bone so it's not falling in. And actually the nose looks normal again. So that's why I use the piece of paper to see what side of the nose looks right. And maybe you can do that at home and then impress them when you turn up and say, look, I think actually it's a type 1 fracture on the left-hand side. But you can look clever to doctors later. I hope that's been of some use to some people out there. Please do see your surgeon early if you have a fracture. Don't wait for longer than 2 weeks. Oh, the one last thing I should say is that children heal an awful lot quicker. So the younger you are, the quicker you heal. The bone sets quicker. So 2 weeks is for adults. It's not for children. Children heal so much quicker. So you need to see your doctor sooner. So the window of opportunity to get your nose sorted is smaller. But the good thing is that typically children don't need a rhinoplasty. I mean, typically you can't have a rhinoplasty until they've stopped growing, 17 to 21 years old, to change the shape of your nose, or your nose will look slightly strange when they become adults. Or that there's that risk, should I say. And so even if your nose is off to one side, as you grow, the nose sort of straightens itself up anyway. But rather than having a blocked nose until the age of 17, often it is a good idea to get your child in and seen quickly to have that nose straightened up again. Again, I hope that's helpful. This really is the end of the video. Take care. Bye-bye.